My name is Xander Kashub. I am a food service worker here in Jeffco. I'm also the JESPA president.
Oh, I also forgot to include that we are here to discuss bargaining jointly with JESPA and JCEA and district management.
My name is Vicky Flores, and I'm JESPA staff.
Thank you.
Sarah Smith, preschool.
Nikki Saunders, Health Tech.
Darcy Hassler, paraprofessional.
Dale Munholland, JCA Vice President and Social Studies teacher at Pomona High School.
Rob Cassidy, Stanley Lake High School science teacher and on JCA.
Michelle Malis, high school Spanish teacher and JCEA bargaining chair.
Stephanie Jones, social emotional learning specialist, JCEA.
Good evening, everyone. I'm Amanda Perazio. I am the Chief Human Resources Officer for Jeffco.
Hey, everyone. I'm Jennifer Kimpson. I'm the Executive Director of Labor Relations.
I'm Jen Christensen, the Director of Labor Relations.
I'm Gretchen Carter. I'm the Director of Student Discipline for Jeffco.
Krista Wilson, principal at Columbine Hills Elementary.
Martha Sheehan, I'm a Director in Teaching and Learning.
Maria Messer, Executive Director of Special Education.
Caroline Frazee, principal, Arvada High School.
Michelle DeAndrea, principal at Bell Middle School.
Sue Ann Hawley, Director for Early Learning in the Division of Teaching and Learning.
Jessica Goodkin, Director of Special Education.
Tanya Lopez, Director of Professional Learning.
Katie Jeter, Director of Resources for Food Service.
Brandon Rude, Dispatch Manager.
Good evening. I am Mark Strelo, Director of Custodial Services.
I'm Mike Hins, Director of Fleet Services.
Right. Well, we got that done quickly. I was a little nervous. Okay. So I'd like to start off with the overall overview and the purpose of this bargaining session this evening. The purpose of today's bargaining session is to engage in open negotiations between district management and JCEA and JESPA concerning employee health and welfare benefits, as well as the district contributions towards these benefits. This aligns with our collective bargaining agreements, which mandate annual negotiations on compensation and benefits. We will also review and consider the recommendations from our Benefits Advisory Committee, also referred to as the BAC, reflecting our shared commitment to maintaining high-quality, comprehensive, and cost-effective health and welfare benefits for all district employees. By approaching today's discussion with the spirit of good faith and open mindset to creative problem solving, we aim to ensure that the outcomes of our negotiations serve the best interests of our dedicated staff and Jeffco's educational community. If Jeffco starts to offer more competitive benefits and continues to work on salary increases for its employees, Jeffco can once again become a district that attracts and retains its educators.
All right, so knowing that this is a new thing for us doing this joint negotiation, we figured it would be good to kind of set some process rules, some ground rules for how we're going to approach this negotiations. I think we can walk through an agenda for this evening, as well as kind of go through some of those process things. So we'd like to set those ground rules in the beginning. Then we're going to kind of go through kind of just an explanation of how benefits are negotiated. They're similar to each bargaining unit, but there are, they're pretty much the same, actually. And walk through a little bit of the back MOU language, and then give a little context to why we're here, what we're doing, and then we'd like to share a few stories from workers in Jeffco on why this is important, as well as then walk through our proposal. Part of that proposal is also going to kind of bring in the recommendations that the BAC has made through their work as a committee. After that, we'd like to have a break for dinner and caucus, and then we will be ready to hear from the district on what they what they're interested in and what your proposal could potentially be. Does that sound good to everybody? Very good. Okay, so let's like to collaborate on some ground rules here. So if there's anything anyone would like to to add, please don't hesitate to speak up. We're going to approach today with a kind of a hybrid model, knowing that JESPA uses a traditional model negotiating, JCA uses more of a hybrid model. So we're going to approach this with a hybrid model, redlining proposals, passing those back and forth. But also, like I said, we want to share some stories, share some interests, and why this is important to workers.
I have a question about the red lines. When we negotiate, the district management uses, their color's red, right? And we use blue for our proposals as far as back and forth. Do we want to do something similar here, or are we going to do Word documents or Google documents, or how would we like to do that?
We tend to use Word or a Google Doc just so changes are tracked. So we'll send you over a Word doc with so we can track changes.
Yeah, but the processes look very different. So we track changes with JESPA, but with JCEA, we highlight the changes. We cross things out and highlight, but we don't use track changes. And so we're able to switch task over here. If it becomes confusing, we can very easily flex in and out of whichever method works the best.
You want to use track changes then? Okay.
That sounds good with you all?
Does that sound like a good agreement?
Yeah.
Okay.
Great.
All right. Do we want to share the screen
Yeah.
so we can maybe get that down? Okay.
Oh, you're right. Sounds good. Okay, so like we said, we'll use a hybrid model. We will track changes in Word.
We'll make that bigger once if we do the slideshow, we can't type it. So.
We can email proposals back and forth. I think that's a good method. Okay. Caucuses at any time for either side. Reasonable time, obviously, but I think if anybody wants to call a caucus at any time, that's okay. And hopefully, this should be relatively smooth here, seeing as we're only really doing one kind of proposal back and forth. So we're doing benefits, we won't have to go all over the place, we're not doing multiple articles, so hopefully this will run fairly smoothly. Is there any other suggested process things?
When we email language back and forth, do you want us to email all of you, both responses, or should we just email JESPA with JESPA's language and JCEA with JCEA's language? I assume that you'll be providing two separate red lines and that you're, oh, no?
No.
Okay, I didn't, so you'd like to streamline potentially, and both articles in both agreements will read identical? Okay.
That's correct.
Sounds good, thank you.
But yeah, you can email, how about we email Vicki, Christine, me, and Brooke, and we can share with our team. And then we'll email the three of you.
Okay.
And bargaining chairs.
Yeah, bargaining chair, sorry.
It's very strange with y'all behind us. Okay. Okay, any other suggested ground rules, norms? Okay. The three of them. Yep.
If we need more time during caucuses, who would you like us just to text you, Amanda? Okay. And then you just want to text Xander and I? Okay.
Okay, if that's agreeable, I think we can move on.
Wow, this is going really smooth. Okay. All right, so now we're going to do a brief explanation of benefit negotiations. So the overview of how benefit negotiations function with JESPA and JCA, and bargaining. So per JCEA and JESPA collective bargaining agreements, the district is required to negotiate over benefits and the cost of benefits. In JESPA CBA, it's Article 3-2-1, All provisions of this agreement pertaining to the compensation and benefits will be subject to negotiation each year of the agreement, including, but not limited to, salary advances, cost of living allowances, employee health and welfare benefits, the district contributions towards those benefits. And then there's more, but I'm not going to read all that. JCA, CBA, it's Article 4-1-2. Pursuant the Colorado Revised States, it's 22-32-110. 5, all provisions of this agreement pertaining to compensations and benefits, including but not limited to the salary advances and cost of living allowances, employee health and welfare benefits of the district contribution towards those benefits, and will be subject to reopening each year of the agreement. We're also going to talk a little bit next about the BAC MOU language. This committee is an advisory body only, and any changes recommended will be forwarded to a joint JCA-JESPA bargaining team for negotiating a final agreement. The BAC may recommend contribution strategies to the bargaining teams, and based on these agreements, the district must negotiate the plans and the contributions to costs with both JCEA and JESPA. To summarize, the BAC's intended role is to make recommendations to the bargaining teams and only to recommend. Nowhere does the Benefit Advisory Committee make decisions or have the authority, nor is it a committee or a body of advisory committee, nor is it a committee, it's only a board, nor is it a committee, a board advisory committee, so it's not supposed to be making recommendations to the board. The committee is advisory to the negotiation teams, which is all of us here tonight.
I think that's important context. Good. I think that's important context to understand before I give a little bit of overview of how this year has gone, given the recommendations from the BAC and the RFP committee that was formed for the new vendor choices we have in front of us. So we have a significant concern with how this year has gone. According to each collective bargaining agreement, the Board of Education, through its designated representatives, is obligated to negotiate employee health and welfare benefits, including the district's contributions, with each association prior to any formal decisions. However, it seems, well, it's actually reality that the board has already voted on these benefits before we've had the opportunity to engage in negotiations. This seems to have circumvented the agreed upon process, and it's concerning. We believe it's essential to address this matter here to ensure that we adhere to the established agreements. So this year in January at a school board study session, the district staff led by Adam Barnett made a recommendation to adopt a United Healthcare plan directly to the Board of Education, indicating that the Benefits Advisory Committee had unanimously approved that recommendation. Being a member of that committee, along with many of my colleagues here tonight, we had never made that recommendation. We had never voted once to recommend these plans or these vendors to the Board of Education. And even so, that's not the role of the BAC. The role of the BAC is to recommend plans and vendors and anything regarding benefits to the negotiation teams. The district put this recommendation on a consent agenda for the school board in the middle of January, I believe it was January 16th or 17th, to eliminate Aetna and to adopt a $26 million contract with United Healthcare. That was voted and approved by Jeffco School Board. That was before we did any negotiating. Ultimately, at the January Benefits Advisory Committee meeting, knowing that the board had already done this, we felt it was important to vote on these recommendations that were recommended by the RFP committee. Now, I want to tell you that that vote was not unanimous. That vote was a 3-3-1 split, was not unanimous, it was not clear whether or not we wanted to actually make that recommendation to say yes to United Healthcare and Kaiser. So by taking that action, before these negotiations took place, the duty to bargain those health insurance plans has not been met. We believe the district has violated the Benefits Advisory Committee agreement and negotiations processes of both contracts yet again. This seems to be a pattern over the last few years.
Okay, so moving forward, since we are here tonight knowing that UHC ultimately has been accepted by the board and is replacing Aetna, we need to move forward in negotiating the benefits and the cost of benefits. First, we'd like to review the recommended plans put forth by the Benefits Advisory Committee. Are they recommended yet or still need to be recommended by the BAC? Okay. They should be brought to the table every year, they should be brought to the table even if a rubber stamp from them is in order to TA. Second, we will make a proposal on the contributions to benefit premiums. So now we're going to move into our stories. And the impact of rising healthcare costs and limited options on employees and their families. Okay, so this year, when we put out our survey, we received many stories from educators regarding benefits and leaves. This is just one of the moving stories that underscores the critical need for a comprehensive and supportive health benefits for our educators. I'd like you to consider the journey of a dedicated teacher who faced a sudden health crisis, illuminating the profound challenges that can arise when personal well-being intersects with professional dedication. Many educators in Jeffco all too often relate and have experienced these challenging decisions. In September, she received a diagnosis that necessitated an immediate radical hysterectomy. Her medical team urged prompt action, emphasizing the urgency of the situation. However, her unwavering commitment to her students led her to make a heart-wrenching decision. She postponed her surgery until November 1st, aiming to align her recovery with school breaks to minimize disruption. This selfless act, intended to benefit her students, came at a significant personal cost. The delay not only posed risk to her health, but also resulted in the exhaustion of her available sick leave during her recovery. Consequently, she faced a reduction in her salary for the days she lacked sufficient leave, compounding the financial strain of the mounting medical bills. The challenges didn't end there. Navigating the administrative processes to secure her leave became an additional burden. Despite her proactive efforts in communicating delays with the district leave department meant she received necessary information and support only after her principal intervened weeks before the scheduled surgery. Reflecting on her experience, she expressed a deep sense of disillusionment. Her attempt to prioritize the needs of her students and the district was met with systematic shortcomings, leaving her feeling unsupported during her most vulnerable moments. This narrative is not unique. Many educators encounter similar hardships when unforeseen medical issues arise. The combination of high medical expenses, limited leave, and administrative hurdles can lead to significant financial instability. It's essential to recognize these challenges and work towards solutions that provide adequate support for educators during medical crises, ensuring that they can focus on recovery without the added burden of a financial strain. Maintaining high-quality, comprehensive, and cost-effective health and welfare benefits for all district employees is not just a matter of policy, but a necessity. Such benefits ensure that educators can access the care they need without facing insurmountable financial obstacles. By investing in a robust health benefits, our district will not only support the well-being of their staff, but also uphold the quality of education by retaining healthy and focused educators. It's imperative that we prioritize and protect these benefits to foster a thriving educational environment for our students and the Jeffco community. Sander?
As someone living with multiple chronic autoimmune disorders, including type 1 diabetes and ulcerative colitis, I've spent my life battling not just my health conditions, but also the unforgiving reality of the American healthcare system. I've been forced to ration insulin, something no one should ever have to do. I've endured prolonged hospital stays and months-long high-dose steroid treatments just to survive. Without healthcare and health insurance, I would not be here today. Even with insurance, survival comes at a steep price. Each year, I must plan to pay thousands of dollars out of pocket on top of my premiums just to afford the medications and supplies that keep me alive. I live in constant fear of catastrophic medical events because I have already lived through them. 2 years ago, my dentist told me I needed 4 intensive oral surgeries, costing tens of thousands of dollars. Only one of them was partially covered by insurance. And yet, I know my situation is not unique. Many of my coworkers face even greater hardships when it comes to accessing and affording health care. And I'd like to share a few of those experiences with everybody. I cannot add my husband because it would basically be my whole paycheck. That is gone. I can barely cover myself and my children. I have no money at the end of the month, and I will have no retirement. I just had a PET scan and had to pay $800. I could not survive if I did not have a husband. I can only afford the high deductible insurance. My other family members were on Medicaid, but that will be canceled soon, and I will need to look on the exchange to find something we can deal with. It makes me only go to the doctor when I have to, even if I need to go more often. I wish Jeffco would offer something my family could afford. It should not cost me half my paycheck a month or more. It is expensive and about 75% of my take-home pay. I have found that I almost never reach my total out-of-pocket amount, so I end up always having to pay. I know that I sometimes won't schedule appointments or don't get the care I need because I can't afford it. We pay so much for the insurance and we have the lowest cost one. It cuts into paying for other household bills. Also, our deductible is so high that when my kids need a procedure done, we spend so long paying it off that we can't afford to have other visits done. My wife had to go back to work just so we could afford health care. No way I can afford to cover my family, $1,200 to $1,300 on a $1,700 gross paycheck. A lot of out-of-pocket cost until deductible kicks in. Money out of my paycheck I don't have because I'm already struggling to live and pay bills each month. If I can't make all of my bills with a hard full-time job like this, how in the heck do you think it is with paying insurance premiums and copays? Can't afford copays and deductibles, we are in debt and can't go to the doctor till we pay that off. I'm paying for insurance I can't even utilize. We put off injuries and pain until we can afford to pay. I can't afford to go to the doctor. I avoid going to the doctor due to cost. No one should have to choose between paying for life-saving care and meeting basic needs. The Jeffco system is failing us, and it is time for a change. So, next. I would like to walk us through the back recommendations that have been made this year. Because like we said before, those recommendations should be coming to these teams sitting across the table from each other today. Now, no, can you go back one more, please? Yeah, you're good. Use the arrows. technical difficulty. Hold tight. There it is. Okay. So there was an RFP committee that voted to recommend United Healthcare and Kaiser and to drop Aetna. When that vote came to the back, we voted, like I said before, 3-3-1 split, whether or not to recommend Kaiser United Healthcare. We have also voted to recommend plan designs, and I would like to bring those recommendations to the two teams. All right, I know this is extremely tiny, but these are the plans that the back team has recommended. You see 3 Kaiser plans and 2 United Healthcare plans. Kaiser plans are effectively the same, and the 2 United Healthcare plans, one is a high deductible plan and the other is a plan called Surest. We can share this with you guys. I'm sure you have access to this. This has already been provided. This is a district slide.
Michelle's going to add a link in our shared agenda, and then you can look at this and make it bigger if you'd like.
Yeah, we'll share this with you.
Is this from the BAC presentation or the board presentation?
This is from the BAC presentation. Yeah.
Thank you.
I think they're also on this slide. They were included at the Aetna plans, but I got rid of them because we are not recommending Aetna. So I just wanted to be clear that these recommendations are coming to these 2 teams here today to be negotiated. I can go to the next slide. These are the 25-26 rates that have been proposed from Kaiser. And again, we will share this with you. You can go to the next slide. This is the plan design that was recommended by the BAC from the United Healthcare. Actually, I guess this is just the Surest plan. Can get into what that means. I haven't totally wrapped my head around it. But Rob, if you want to jump in at all, you're good? Okay. So again, just wanted to be clear, we wanted to share these with you today, just so we have something to work off of if there are questions on what the BAC has recommended. Next slide.
So we'd also like to point out that these were the 2024 BAC recommendations on the contribution strategy, and we're disappointed that these were never really brought forward, even or shared with our board as well. So we just want to make sure that we highlight that here and that we share them publicly today, because they weren't shared last year.
Yeah, ultimately these plans were not brought to the teams as the BAC MOU states. And we wanted to share these today also to be kind of share context on what our proposal is going to be. I'd like to share that with you next.
And so these proposals came from the BAC recommendations.
Okay, so this is our joint benefits proposal. Benefit structure. A non-taxable employer contribution will be made by the district to cover 100% of employee-only benefits. For plans including spouse, child, and/or family, employer will cover 80% of the total cost of benefits. EAP. The district will maintain a fully staffed employee assistance program. This will mean the district will make 4 full-time counselors and 1 full-time office assistant to be made accessible for all employees to support their mental health and well-being. Services available through EAP shall include individual counseling, group mediation, preventative workshops, mental health education, and other outreach services. 1 school meal per day shall be free for all employees. Before and after school childcare shall be provided at no cost to employees. one BAC representative from JCEA, and one BAC representative from JESPA will present the BAC presentations, recommendations to the school board. Any questions?
Not yet.
Michelle added that to our agenda and our.
The link to the, okay.
Yeah.
Yeah, I'm sure we'll have lots of questions. I don't have any yet. I mean, the first question comes to mind is, have you costed all of this out? Because as you can imagine, that is, we can't make any decisions without costs. And so that's what we need to know, is if you've costed any of this out yourself, or if you need us to engage our financial services department to cost all of this out, which will require FNS and financial services, school age enrichment, and potentially human resources with regard to the cost for counselors and a full-time office assistant. We're happy to. It'll just take a little while.
Yeah, we understand that there's a cost involved.
Rob did cost some of the items out. Rob, do you want to speak to that?
Okay, I'm failing on the microphone department. And I don't know if I have the figures handy, the exact figures handy here, but I did cost out, and there were a lot of assumptions made because things have changed in terms of, we had data from last year, and then there's been, a year since then. I believe, with all the assumptions, this worked out to about $18 million. Ish, 18 to 19 million in addition to in additional costs.
Just the 80% at the top, or all of these costs together are approximately 19 million?
The benefits part.
So the very first paragraph?
The first 3 lines.
Okay.
With the 100% of the individual and then the 80% of the other.
And is that using the new estimated premiums, even though they're not necessarily finalized yet? Because I know that the Kaiser ones get set by Kaiser, but the what we discussed in the last BAC meeting was there's a confidence interval that has to be set with self-funded plans. And so therefore, if that changes, there could potentially be a change in the premiums for UHC, Surest, and high deductible. I just wondered which.
I think I was using staggered last year's data because it hadn't been finalized. For
Okay. Okay.
It's just a rough estimate, knowing that it's very rough.
Thank you. Yeah, it's really, that one is a really quiet mic.
I have a quick question. Regarding the before and after school childcare shall be provided at no cost to employees. Not all of our schools have SAE, so how would that be proposed? Are you suggesting that all of our schools will need to have SAE or school-aged enrichment programs, or because a lot of them use like boys and girls clubs and some other outside agencies, or not at all?
That's a really good question. I think we should staff before and after school programs at all our schools.
I'm not sure if there's any other questions I can ask right now. I mean, as you can imagine, I'm going to need to engage quite a few people in costing some of these things out so that we know the total cost of it. But certainly we can take a caucus and we can come back with additional questions if we have them. We'd be happy to do that.
That sounds good.
Okay. Brandon, wherever you are, do you want to take us offline? Yeah, of course we want Christine to introduce herself.
Christine Wiggins, JCEA.
That was perfect, Christine. That was the perfect introduction. Should we start with 20-minute caucus? 30-minute caucus.
How much time do you think you need to get all the data?
Oh, gosh. Weeks. I don't know. I mean, as you can imagine, we're all mathematicians, and so we'll certainly try to run some rough estimates, but, and I'll certainly reach out to people to see if I can get some assistance in doing so. I'll just be really honest with you, in the spirit of good faith bargaining, I'm not going to have all the data tonight. There's no way. You know, as you can imagine, one of the hard parts about getting some of this data is I have no idea how many children our staff have that would need childcare for before and after. So all I could get really is the cost of the before and after school care, and make a guess on how many children our current staff have and how many would need or want the before and after school care. So that would be a challenge, but it's certainly something we can estimate. And so, yeah, that's where I'm at.
Okay.
Yeah, I mean, obviously the 80% of the plans is going to be an estimate too, because, I mean, as a BAC member, you know that those premiums haven't been finalized yet, and so we would be probably guessing higher than low, because I do know that one of the conversations was around increasing that confidence interval because we continue to go in the red on our spending, and so, you know, we'll want to consider that too.
Okay, that's fine. How about we do 20 minutes?
Okay.
And come back, and we can maybe have more, if you have more questions.
Yeah, that sounds great.
Figure it out from there.
Okay. Thanks, Brandon. So everyone, we will be back. We will be back.
Welcome back, everybody, to a joint negotiation session with JESPA and JCA and Jeffco Public Schools. We are back from a dinner break and caucus and ready to hear from Jeffco.
Thank you, Xander, and thank you everyone for your patience. We realized that our food was arriving right at the time we were supposed to be coming back, and it took us a while to come up with calculations. And so we have both a presentation to share with you around the RFP process and what took place with regard to the RFP process and the results of surveys that have been sent over the past 12 months related to benefits. And so we'd like to share that with you. And then we have identified some very rough estimated costs of what some of the asks were that you have proposed in your proposal this evening. There are some costs that we are unable to determine simply because we don't know numbers of employees with children, for example, that kind of information. But we do have some data to share with you around the proposal that you have shared this evening. So Jennifer is working on getting the link to the presentation we're about to share into the agenda so that you can access it. And I will go ahead and share my screen and present on, hopefully, if I can find the correct. There it is. Okay. So as soon as we get that link in there, you will be able to access this as well. But until then, we'll go ahead and get started. So this is just a year at a glance for the 2024 to now benefits for this evening's information. So I apologize, this is a little small and I don't know how to make a PowerPoint any bigger. So in the 24-25 school year for the beginning in July 1st, 2025 medical benefits, we engaged in an RFP, which is a request for proposal for employee health insurance. This is a typical process that we do anytime we need to procure a vendor for a large expense the district is going to incur. We do this approximately every 5 years for health insurance. And so the last time we did this was 5 years ago. And so doing it this year, we were right on cycle in conducting the RFP. So all bargaining units were invited to participate specifically through the Benefits Advisory Committee and designate representatives to serve as evaluators and make a recommendation. Of the 9 BAC members, I believe 4 participated. We did also have district administration that was a non-voting member of the RFP Evaluation Committee, as well as an employee who is part of the JESPA bargaining unit. I am unfamiliar if she was a dues-paying member or not. We also had 2 JCEA members from the BAC, 2 JCAA members from the BAC. Unfortunately, JESPA was unable to participate, although invited, I assume due to scheduling constraints. Proposals were evaluated based on criteria from the Jeffco Benefits Survey that was provided last May, as well as the business needs. There were no proposals received to replace Kaiser. However, there were other secondary carriers that were considered. As you are all aware, United Healthcare Surest was selected as well as Kaiser, alongside Kaiser, and approved by the Board of Education. So how did we arrive at this executive summary? So in the spring of 2024, there was a request made to the Board of Education that Jeffco would enter into a medical RFP, and that request was made by JESPA and JCEA. The concerns that were cited were around price increases from Kaiser and Aetna that you had experienced as employees, and we too had experienced as a district. So concerns with access to wait times to get an appointment were also elevated, as well as dissatisfaction with the limited provider access to the Aetna network. So as everyone is likely aware, especially anyone who happened to have been using part of the Aetna network, was New West Physicians, and that particular large Front Range network was reduced from Aetna, thus reducing their ability to provide a large network and multiple options for healthcare providers to our employees. Of course, the district agreed to conduct the RFP with back involvement in the fall of 2024. So in the spring of 2024 as well, after it was determined that we would enter into an RFP, we wanted to ask our employees what it was that was most important to them. So the district, in partnership with the BAC, and they collaborated to develop a benefits engagement survey to gain insights into what aspects of Jeffco benefits programs employees value. And the results were used to then inform the medical carrier RFP evaluation, which included plan design recommendations and the contribution strategy considerations for 25-26. The survey was open at the very end of the school year, May 16th through May 28th, and there were approximately 1,100 responses received, which unfortunately is only 7.5% of the total employee population, but just a uneducated assumption is that those who cared about medical insurance the most are likely the ones who responded. So the first employee survey, again, I apologize, this is so small. These are the themes that were used for the RFP determination. So 49% of those enrolled in the medical plan as of last spring indicated that they were either satisfied or completely satisfied. Of those 49%, 47% were enrolled in Kaiser, 55% were enrolled in Aetna. 33% of the total those who responded and were enrolled in a medical plan indicated that they were dissatisfied, so approximately 1/3 of those who responded. 61% of those who responded were dissatisfied due to the out-of-pocket cost, and 34% were dissatisfied due to coverage. 60% prioritized a lower out-of-pocket cost over provider accessibility. 72% wanted to ensure that we continue to have multiple plan options and cost structures for employees to choose from. And then approximately 91% valued the complementary medicine benefits, so things such as acupuncture, meditation, and other options such as chiropractor. Thank you. 92% valued a 0% or zero copay for mental health services. We also asked a subset of those questions around the use of our in-house employee assistance program. Of the respondents, 12% had utilized the EAP, and 19% indicated that they had sought mental health benefits through their medical plan, and that was all last year in 23-24. So of these priorities, there were 3 that were really used as the driving force. Number 1, lower costs. Number 2, options, various options for employees to choose from within their plans. And number 3, the complementary medical services that could be added into or achieved through the medical plans. In the summer of 2024, there was additional information sought out through employee focus groups. So additional employees that had taken the survey and others were asked to join these focus groups, and they were asked additional questions. Unfortunately, I had the link in here, but it was the wrong link, and so I just have to get that link back in there, and I'll make sure that I share those results with you. As you can imagine, it was continuing with those 3 themes: lower cost, access to complementary service, as well as options for employees. This was our medical RFP timeline, so you can see that it happens in phases. So at the very beginning, really defining the key priorities and the goals, surveying the employees, we just talked about that. Analyzing the survey results happened last summer, and then developing the content for the RFP. When we put out an RFP, we have to seek really specific information from the vendors who choose to respond. And then, of course, conducting the focus groups I just referred to. Last fall, they launched the RFP and received responses as of October 10th. And then the evaluators got together and analyzed the proposals that were shared. And then there were finalist presentations by the vendors at the beginning of December. Just so everyone is aware, we do use a consultant company called Lockton to support all of these processes because they are really the experts in helping us to identify the cost, the services, et cetera, and helping us with plan design as well. The Board of Ed reviewed the final proposal on January 16th, as Xander had presented, and approved the contract with the two vendors selected, of United Healthcare Surest and Kaiser. In this current phase that we're in is phase 4, and this phase is getting the exact contracts and budget and appropriations to the board for approval, for further approval, as well as communicating to employees and educating employees on what the new plan options are going to be. Additionally, setting the new premium rates that has not been finalized yet. What we're using today is all an estimate. Thank you. And the proposal is now linked, the presentation, you mean, is now linked into the agenda so you can access it, since this is tiny. And then finally, phase 5 will be to turn on the new benefits as of July 1. Okay, so a little bit more about the RFP award to Kaiser and United Healthcare. The Kaiser renewal is unfortunately, there aren't a whole lot more options that are as cost effective as Kaiser. And so we certainly want to continue offering that to our employees. 70% of our employees who are currently enrolled in our medical plans are enrolled in Kaiser. And so our intent is not to disrupt that service of care that people are already using and seeking and have become familiar with over the years of being able to engage in Kaiser. There are no changes to the plan choices currently. There's a $1,500 DHMO, a $2,500 HDHP, which is the high deductible, and a $4,000 high deductible health plan. These Kaiser is a year-to-year contract. Additionally, the second award was to United Healthcare Surest, which is to replace Aetna. One of the reasons is because it was 4.5% lower than Aetna's renewal proposal. Aetna, I believe, had a 16% renewal increase had we chosen to go with them. This is a self-funded plan, meaning that Jeffco pays for the claims up to a certain amount until an insurance company takes over. There's an estimated 6 to 11% increase in our premium rates, which again would have been approximately 16% increase under Aetna. This does introduce Surest, which is a new plan, and you'll be able to hear a whole lot more about this during this phase of the selection. And basically, it is a zero copay plan, still has an out-of-pocket maximum, and you essentially use an application on your phone to identify costs, and you can use that to determine where it is that you want to go. You have choice between a knee surgery with one surgeon and a knee surgery with another surgeon, and you get to see the cost up front and choose between potentially two different surgeons. It has been explained to us that the more cost effective are those medical providers who are providing more efficient care, and they're seeing more positive results from their patients. This is a less than 1% provider disruption because the majority of the Aetna enrollees will be able to choose the exact same doctor they currently have. And 30% of our medical enrollment is in Aetna currently. It is also a year-to-year contract. So finally, our last part of our presentation, there was a second employee benefits survey that we together with the BAC developed in November and sent out between December and January for our employees to give us additional feedback into how we want to distribute the cost of benefits. There were 1,500, about almost 1,600 responses, which is 15% of benefit eligible employees. Linked in here are survey results and an entire folder of every single open-ended response that you might want to read. But the summary of the results are on this slide. So we asked about a fixed dollar contribution, which is what we currently have of $640 per month per employee, per full-time employee, versus a percentage contribution. 41% of respondents indicated that they somewhat or strongly prefer a fixed dollar benefits contribution. 36% indicated they somewhat or strongly prefer a percentage of the total premium. 12.7% were neutral on that question. When asked about the district providing a contribution towards benefits for dependent children and/or spouses, 56.7% somewhat or strongly supported the district providing additional benefit contributions toward children, and 44% somewhat or strongly supported additional contribution towards spouse coverage. When asked about increasing the employee-only benefits premiums to help reduce dependent premiums, 63% were somewhat or strongly opposed, 21% were somewhat or strongly in favor, and 15.8% were neutral. And then finally, when asked about providing more benefits contribution for lower paid employees than higher paid employees, 86% were not in favor or only in favor as long as their own cost does not increase, and 14% are in favor whether or not it increases or decreases their individual cost. So, we will be using this information as we consider your proposal and share a counter on the 20th. Today, what we'd like to share with you is the very rough estimated costs that we have determined. Please note that there is only maybe one math teacher among us. Might have been a kindergarten teacher and an English language arts teacher who were running some of the numbers. But here's what we have figured out. So with regard to your request for the benefit structure being 100% total coverage for every employee-only benefit plan, and then for 80% coverage of plans including spouse, child, children, or family, at 80% employer coverage, the estimated cost for premiums of the current just over 5,000 employees who are currently taking our benefits plans is $75 million. That's the total cost. Currently, we pay $640 per month. The increase in that cost would be $19.8 million. So that's an additional $19.8 million that the district would be covering. The estimated for your second request, the EAP, to be fully staffed, and we do appreciate that you wrote exactly what that meant, because we don't always understand what fully staffed means. So thank you for describing that. And that included 4 full-time counselors and 1 full-time office assistant. Just for reference, the title is tech, so that's why I wrote the word tech down below, of our current employee who's in that role. That is an increase to 4 full-time counselors. Currently, we do have 3 counselors. They are not full-time. And that increase, so this is not the total cost, but the actual increase, is $333,201. And then the increase of our EAP tech, who's currently half-time, to full-time would be approximately $38,000. So that's an increase of $371,000 for the EAP. That does include salary and benefits on our current salary structure. As you're aware, if any steps or lanes or COLAs are applied, that would be impacting that cost. With regard to 1 school meal per day, free for all employees. So we do have federal guidelines that indicate how much it costs for an adult meal. It's currently $5.25. There is a possibility that it may go up to $5.50 next year. We have not received that new cost yet. If all 14,000 employees were to take this benefit, it would be approximately $13.4 million. As we all know, it is unlikely that all 14,000 employees would take this benefit. Number one, because many of them are not in schools. Many of our employees are intermittent. They're in and out of schools, or they are at central buildings. So we did an estimate, assuming that only 50 to 60% would participate, so approximately 8,400 employee meals per day is about $8 million per year. And please note that that does not include the additional cost that it would incur to potential labor increases at school sites or central sites. And finally, the before and after school care, this one is really hard to estimate. And so we wanted to just give you some data that we have. So currently, School Age Enrichment is our district-run or managed before and after school program. School Age Enrichment is in 27 of our elementary schools and 2 of our early learning centers. It is not funded by the general fund at all. It is tuition funded only. To offer free childcare for staff, we would need to dramatically increase charges to families who are not children of staff. And so just for reference, there is currently a Jeffco employee discount that allows for a slight decrease in the total cost. The cost per day is, if you go in the afternoons, it's $26.25. It's a longer window in the afternoons. And then in the mornings, if you come before school, it's $15.25 per day. The total per week, which is PM only, which is oftentimes what our folks are seeking, is $131.25. This is in the mid-range of most local providers. It's in more or less $2.50. And just for reference, many of our, you can see only 29 of our schools have school age enrichment. That means that there are many other schools that do not have school age enrichment. They use other providers that are within their community. For example, in the mountains, they use one called Rocky Mountain Kids. And as you know, we don't have control over their ability to provide discounts. Some, I think, do provide discounts, and some do not to employees. To open a new school age enrichment program, it costs approximately $25,000 to $35,000. And we are currently running in a deficit and having to determine modeling for coming out of that deficit in that particular program. There are 9 other providers within Jeffco at the other elementary schools, of which there are 79 elementary schools. And 2 to 3 schools right now do not have before and after school childcare. So pretty much all of the others do, but again, only 29 of them have SAE. So the estimated total cost of what you have put forth in your proposal is $33,700,000. This does not include the before and after school care you've requested. And the total package cost that I put in there, this was including like if it was all medical benefits, it's nearly $89 million. And so, so right now, there is an appendix that provides for you some RFP updates that were provided to BAC along the way, just so that you know what was being communicated and how that was being, how we were trying to be transparent with the RFP process with all members, regardless of their participation. So, as you can imagine, we do not have a proposal that can match that this evening. We are happy to go back to our benefits team as well as our financial team to discuss these options that you have put forth, and we will do our best to come back on the 20th with a counter proposal. We did wonder about red line language, if you had any red line language of your current benefits language in your agreement that you were intending to share, or if that will happen separately from the joint negotiation.
If there is any red lines in the CBAs, we can bring it next time. But yeah, our proposal's in the slides.
Okay, that sounds great. What questions do you have about all the stuff I just said?
All the
Yes,
words.
I do have some questions. We have some questions. I think to start, I would just like to say, going back to the surveys, multiple surveys that have been conducted by Jeffco, I think to characterize that the only people who filled out the surveys are the ones who care the most is a false assumption. So we don't believe that. We know as a representative of JESPA, access is really a factor to a lot of these things. So seeing up on there that 6% of my union responded is not a threshold that I would say is a good one to base all of this data off of. Also, when it comes to surveys conducted by Jeffco, it's just very hard for us to think that Jeffco has knowledge of what our members need more than the unions do. And so to base these assumptions off of the surveys again, I don't believe is accurate. We've talked a lot about the surveys themselves, especially this one that happened over the holiday period. Even though the BAC contributed to creating those surveys, the questions were very confusing. We're not asking for people to pay a percentage on their paycheck of benefits, so it's all fixed dollar amounts. It's just what we're asking for is the district to pay a percentage of that. So it would be a fixed dollar amount throughout the whole year. So I think that question is extremely misleading. Me being a food service worker, I do have a question about the meal part as well. And I'm wondering, Katie, are you here? I would just like to understand, if you have any data on this you could provide, how much food is wasted every day in Jeffco? How many meals are wasted?
I don't have any data on that.
It's a lot. A lot of food is wasted every day. And so I would like to see that data to know how much of this cost is actually an accurate reflection of that, because we have kitchen workers who are throwing meals away daily because they're over preparing the food because they aren't allowed to take lunch counts.
Xander, I'm happy to try and get some data for you. I just don't have any available right now in front of me.
That'd be great. It's something we've been asking for a long time too. Rob, I have a question for you. You're a data numbers guy. You've been digging into the survey things, so I'm wondering if you could speak to that.
Yeah, I actually had my hand up to talk a little bit are you done, Xander, in terms of what you were saying? To talk a little bit about the data. And in all honesty, I got the thing. I am, and I don't think I mentioned at the start, I am one of the co-chairs of the Benefits Advisory Committee. We do also have Debbie is in the room. She's also a JCA representative for the BAC committee. And when we got the information from it, there was an executive survey, there was a folder with some broken down survey, and there was some other stuff there as well. I'll be honest, I looked at the executive survey first, or the executive summary first, and pretty quickly it became like a suspicion of mine that there was an intended conclusion that was looked for by the district. So
That was not done by the district. That was done by artificial intelligence.
Okay,
Just so
I'll address
you're aware.
that. Okay, I had heard that rumor.
We used AI.
Yeah, I had heard that rumor that AI was used.
Yeah. It's a lot of data.
So I guess the the issue is, I was looking at that, and it seemed like there was an agenda that was being posed there. So rather than look at the executive survey, I went back and looked at the raw data. And I looked at all of the stuff. I looked at the JESPA results. I looked at the JCA results. I looked at the JCAA results, et cetera. And so I wanted to address, you had several categories here. Oh, that's what I was going to say. Was the, so you have 4 categories here. The first one, you're talking about fixed dollar contribution versus percent contribution toward benefits, and you're saying that 41% strongly or somewhat prefer the fixed dollar amount, 36% strongly or somewhat prefer some percentage of the total premium, 12% are neutral. When you looked at how the survey was given, it actually was a sliding scale. It went from 0 or 1 was fixed, 10 was fully percent. So if you're anywhere in between, you're at something of, well, let's have, something in between where, maybe you have some aspects of fixed, some aspects of percent, such as, I think a value that the district has had is having at least one plan that has 100% coverage. Well, if you do a full percentage model, then it's hard to keep that 100% there. So it stands to reason people are going to pick something in between there. And as a result of that, I can come up with numbers that are vastly different than you on this first thing. For example, I can look and see, well, fixed was a 1. Well, 306 people of 1331 that responded said they wanted a fixed. That's 23%. What that means then is 77% wanted at least some degree of percentage, okay? And that number is...
I don't know if I completely agree with that logic, Rob.
Hold
because
on.
a 2 doesn't necessarily mean I want...
No, I'm not... hold on, I'll get there. But what I'm saying is you can play with numbers here. So to be more, and I realize your point's taken, okay? And to address that point, I can also look at, to me, 5 plus is saying you want a fairly substantial portion of it being percentage. Well, 58% of people, 773 of 1331, put 5 or above.
Isn't 5 considered neutral? Isn't that the center?
No, it's not a neutral. It's from 1 being fixed to the 10 being
Sorry,
percent.
I thought it actually said neutral above it on the survey.
No,
Okay.
it didn't. It was, so when I answered it, I was thinking, what degree do you want? How much do you want percent? How much do you want fixed? So as I'm seeing it, as you're moving up that scale, you're wanting more and more, a percentage model and less a fixed. So to me, 5 plus is the range that, that's going to be you're definitely wanting a portion of it to be a percent. So I can look at the data and, my data, when I'm looking at it, my analysis says, almost 2/3 of the people wanted some aspect of a percentage aspect to the model there. For JCAA, the analysis was, 58.5% had 5 or above on that. Again, roughly, close to 60%. There were some issues on the second one, just to talk about support for kids. I think, our analysis agree pretty similarly there that, there was pretty widespread support in that first question that a lot of employees are feeling that, families are kind of having a tough time here. And because of that, there are huge costs, and if there is a way to support the families, that it would be beneficial. One, from a financial perspective. 2, which wasn't, I think it was raised as a point in the survey, that by having more and more kids in the plan, you can potentially get, a larger number of people participating, and kids tend to have a lower hospitalization rate, lower usage rate, so that tends to reduce fees overall. So there was, if you look at that, both your analysis and my analysis show, pretty widespread support for having, some sort of working toward having kids having, or families having some sort of a economic benefit there.
Did you identify more than 57%?
No, I had 57%. I'm saying we were pretty close there, and JCEA was 59.5%. So in that same ballpark. So I'm saying on that one we agreed pretty much. I think there was a problem though in the next question. The next question on the survey actually asked, would you be willing to reduce the amount that you're getting to help the families? And, you know, that one is the one you cite with, you know, a lot of people, you know, aren't, you know, 63% are opposed somewhat or strongly, you know, in that. And, you know, that makes sense. If you're getting a certain amount of money, I think pretty much everyone is going to say, yeah, no, I don't want to have.
Totally agree.
And there were a lot of comments about that. And I think the AI got a little faked out because that question was asked, and then it, right after that question said, any comments? Well, pretty much anyone who is just by themselves are like, you know, hell no, I'm not going to like take money away from me to pay for someone who had a choice for a family. And I get it, and I agree with that, you know, that's, you know, a very real statement, a real thought, and, you know, a lot of people felt that way. And there were a lot of very strong, passionate statements along those lines.
I'm sorry, Rob, help me understand why it was problematic. I mean, I agree with you. Why was it problematic?
Well, just in that the question was asked, and then immediately afterwards, it's like, okay, now comment. So people are going to have this thing of, you know, do you want to take money away from me to help families? Okay, give a comment. So I'm just saying there's a bit of a leading aspect to that in my mind where, you know, you're going to get people riled up and thinking, okay, I'm opposed to it, and rightfully so in some cases. If you are an individual, you know, I get it. You know, you have made a choice maybe not to have a family. And
It's also an extremely divisive question.
Yeah, I guess, yeah.
Okay. I mean, I think it's saying what we expected it to say, both of us.
Yeah, no, and the results are about what I would have expected for that. But I'm just saying, you know, maybe that played a role or a factor in terms of your AI analysis.
Potentially.
Possibly. Moving on then with the lower age earners, this, providing more benefits for lower paid employees, you have 86% not in favor. If it does not increase their cost, 14% in favor. When I'm looking at it, 878 of 1530, which yes, 57.4%, said, you know, should costs be lower for lower wage earners if no cost increase? Then yes. So again, you're looking at, you know, that 86%, you know, factored in the fact that, you know, if we take money away from you, you know, would you support people? Not, you know, do you in principle support having, you know, people who are earning less money maybe having a lower amount that they have to pay? And again, the data showed about 57% were supporting that. So, you know, what I'm seeing is then, you know, the district as a whole is, you know, fairly supportive of having some sort of situation where people like Xander described earlier in the session, you know, might get a little bit of an economic benefit or economic help to, you know, meet their needs. So that was there. So I guess my grand point here is that you have some information here, you have some statistics here, and you've broken it down by criteria that you saw fit. I can, you know, do the
that my friend AI saw fit, but yeah.
Okay, that AI saw fit.
Gonna lie.
Based on, but AI needs parameters to be programmed in. So you can't just wash it off as it's not my fault, it's AI. Someone put in parameters of, you know, what are you looking for in this? You know, what are you expecting?
Here's what I can tell you. We're not trying to hide anything. The complete survey results are linked right here.
No, I'm not saying you're trying to hide. I'm just saying, you know, when we gave this, you know, we gave a proposal where percentage is important in terms of, you know, that does factor in. It's not a fix. The current situation is what is it, $640 per month per employee. You know, that's a fixed amount every time. And we, you know, like in bargaining last year, we had proposed, you know, in this proposal, you know, switching that to somewhat of a percentage. And, you know, given the numbers that, you know, I was quoting here, you know, I feel this survey even despite, the statements Anders made, in terms of some concerns with the survey, this survey, the one last spring, the one that JCA has given to its members, a couple years ago, all have shown, considerable support for going to a percentage system. They have shown considerable support for, helping people and families out.
Right, and I don't disagree with you, and if not a percentage-based system, potentially a tiered system.
Yeah.
Right, essentially something that people who have full families get a little bit more than people who
Exactly.
have plus dependents, plus spouses, or employee only. I don't disagree with that
Okay,
statement.
then that's good, because to me, that January 2025 summary of results statement, is making a pretty profound, what you are proposing is out of line with what the survey showed. And, I'm just arguing,
Sure.
in my mind, and, in the way I analyze the data, that, is not true.
Yeah, I actually only feel like the first one does that, but the other three, I don't think they do. I don't think they say no to your proposal.
Okay.
The first one is the only one, and honestly, 41 versus 36, isn't that starkly different?
Well, I just wanted to say that when I was reading through the survey and I went down, I always like to read the comments, and I started reading through the comments, and it really seemed to me that people were confused about that question. Either a fixed dollar contribution or percentage contribution. And I felt like, some of the people, that came out in the comments. The other thing that really came out in the comments that stood out to me was that people wanted the district to have more skin in the game. And when we're negotiating these health benefits, they wanted the district to feel the pain that they feel as well. I don't know how to better say it, but as these percentages continue to increase, it keeps coming out of our pockets. And that is what I read in the comments. But the question was very confusing, but when you were reading the comments, you could tell that there was some confusion from that question. And it became very evident that people wanted more contribution from the district because they wanted them to have skin in the game when we're negotiating our benefits. And we know that benefits are an issue. We know that our proposals we're asking a lot, but we are also open to creating plans for these things to happen in the future. What we want is to be like the gold star of Colorado. We want people to want to not only work here, but we want people to want to stay here, and we want our communities to want to continue to send their kids to our schools. And we think that by offering the best benefits and competitive salaries, that this is, and even childcare for our employees, shows that we care about them, but we're also committed to the people that are working every day in our schools and in our classrooms.
Who are committed to the children, right? Because
Yeah.
that's why we're all here.
Yeah,
what we
and
serve.
so, again, we're open to hearing proposals of how this will look in the future. I think it's no secret that, we're looking into, possible mills and bonds in 2026. And we would be happy to help write some of that language to make some of these things happen. We want to be a part of writing that language to help take care of our employees too. So I don't think, some of these things don't necessarily have to happen this year or today, but we could work out a plan as well.
Thank you. There are just a couple other quick things that I wanted to address. In the beginning, when you were talking about the overview of negotiations, you made a statement that, a couple of things actually. First of all, that we were in violation of the contract language in the MOU. You stated that you were not able to bring your proposal last year, but I sat at the JCEA table and we heard that proposal. I acknowledge that I don't believe JESPA was able to bring that proposal, but I did want to just clarify that JCEA did bring that proposal to us at the table.
The proposals were never shared with the board.
Oh, I'm sorry. I thought you said they were never shared with the negotiations teams for negotiations. Okay. Okay, I just wanted to make sure to clarify that. Additionally, you talked about us being in violation of the contract language with regard to negotiating benefits. Is it your hope that you would be at the table with our benefits team and with our procurement team and accounting, that you would, obviously, you were part of the RFP, you were invited to be, and those who could participate did, but is there something else that you were hoping to be part of?
I mean, historically, when Laura Center and Phil Bedford and I worked on this MOU with other people from our teams as well, we had a vision of negotiating these things. Yes, we had people in the RFP process. The BAC is supposed to be making recommendations to our committees, but we want our members and to have input on what plans are chosen. It shouldn't be done behind closed doors in a small room with just a small group of people. A lot of people have concerns about United Healthcare, and I don't blame them. Given the news of denial of claims, I think that we deserve to hear from United Healthcare here. We are all taking, many of us are taking these benefits, and we have fears about them, especially those that don't take Kaiser but have serious illnesses. I was speaking to one of my leaders the other day who has Aetna and is really worried about United Healthcare. And I know I keep using that name, but it's important to see why the recommendation was made in the RFP process, and that murder didn't take place until, I guess it happened the day after the RFP process had happened, and Rob was speaking to me a little bit about that a couple of days ago. Yeah. It was the day of. Yeah. But we want agency, and we want things to be done transparently, and so we want things to come to the table. And our members have been feeling for years that these things are happening to them, not with them. And that's why we want them at the negotiation table.
And are you wanting to negotiate directly with the vendors? Is that the desire?
That would be great if we could.
I mean, if you have the
have an interest in
expertise,
negotiating
if
with
you
the
have the
vendors?
knowledge and the expertise, by all means. I mean, Adam, he, Lockton is our support people. I mean,
Can you go back to the slide on why we're doing an RFP?
this one?
Yeah, so the request to the Board of Education for medical RFP from JUSPA JCA, the first bullet point there says concerns with price increases from Kaiser and Aetna. So why did we come back this year with an increase from Kaiser and an increase from United Healthcare? That's the number one concern for members in Jeffco.
Sure, I'll have Adam answer that question, or Lockton answer that question. I mean, healthcare costs are rising across the country. This is not something that we as Jeffco Public Schools can control.
You know how you could control it is by creating a system where Jeffco has to pay more for it.
But they're still rising regardless
year
of
after
whether we
year,
pay them or
the
you pay them.
costs are we shoulder that increase every single year.
I understand what you're saying.
If Jeffco paid a percentage of the cost, it would benefit you to negotiate better prices with the vendor.
Do you think that we don't want to negotiate better prices? You think we want to pay more and have you pay more?
I think there
That's
hasn't
not
been
true.
a consequence for Jeffco
Yeah,
because
that is 100% not true. That we don't want the cost to rise for us, for you, for ourselves. We pay the same thing you all pay. We do not want the cost to rise, Xander.
when the costs go up,
anyone.
employees have to shoulder that increase. That
I understand that has happened in the past and sometimes not, right? Last year, we increased the employee only to have multiple plans to choose from, right? So sometimes, last year, the employee only coverage, that didn't happen too. And it probably did to the family, the spouse, and the dependents. I don't disagree with you. The one other question I had, nope, it's gone. I think I asked all the questions. I don't think I have any other questions. Did anybody else on your side or behind me have any questions or information you'd like to share? Gretchen has a question, but not a microphone.
I just had a question about the survey, just really more of a logistical thing. If it's an access thing, and I totally get that. So what ways could that be done better so that there is like a more robust response and a better opportunity for everyone? So, and I'm new to this, so I apologize, but if there's a different way, a better way, I would love some suggestions, because I think that could be used also across the board, not just in negotiations, because it's a thing. So
I would agree with you, and I think it would be great if we could reach more people and have a better understanding and better data for how we should go forward. But to be honest, we're not going to negotiate from district surveys. Like, I mean, that's not how we bargain. We bargain from interacting with members, talking to people in buildings, and our own surveys. So I hear you, but I mean, we're not going to come to this table and negotiate from data that the district collected.
I would also add, we've had issues with Lockton for years. They're very expensive. I pushed years ago that we have our own broker, and they have to take our benefits to be the broker, like that we have our own person in-house that, negotiates with the insurance companies. I think it's really important that United Healthcare and Kaiser give a presentation to us at our next session for benefits, just so that it can be transparent and our members understand why it was chosen in the RFP process. I hate the analogy that, we have to choose between a turd and a turd sandwich, but that's what it is. But it would be nice to have all the turds up there giving their proposals, and so that everybody can see what it is. And honestly, I agree. I think we can all agree healthcare sucks in this country, and until we start making them come out publicly about why and how bad they suck, and holding them accountable in public, I don't think we'll see things change until we start demanding that. And this is part of that.
And
so it's not against, you, Amanda, and don't take it personally. It's just, we value the people on the back team. That's a lot of time. We value our members on there. We have great people on there. It's just, we want these things done and open and transparent.
And I appreciate your acknowledgement that, I'll use the analogy just that there are no good options, right? Which is the best of the bad options, and right, the turds. A quick Google search will help you to see that nearly every healthcare company has had an investigation, if not multiple investigations, by the DOJ. So right now it's United Healthcare's turn. Many companies have paid hundreds of millions of dollars because of these situations. It's unfortunate that this one has been so public. Maybe not. Maybe it is fortunate that it has been public because it's really brought to the forefront of what's going on in healthcare across our country. And unfortunately, it resulted in the loss of life. And for that, I am super sorry and regretful that had to occur, or that did occur. The one thing I remember that I wanted to clarify, when I said that the people who responded to the survey are the only people who cared, I didn't intend to say the only people who cared about healthcare. It was the end of the school year, and the people who were most passionate at the end, in the last 2 weeks of the school year, are probably those who are either real angry about healthcare or real happy about healthcare. We usually don't hear from the neutral people. We usually hear from the angriest and the happiest. And so please know that it was not my intent to diminish anyone's in the audience, watching live or here in the room, your care about your own health care and that of your families. But I definitely think the last 2 weeks of school is a tough time for a survey.
I want to acknowledge, I think I'm hearing you say that we all have an interest in lower costs for healthcare. I'm not going to sit here and say I negotiate for admin, but ultimately what you guys get is what we negotiate. So I think we have a very strong need to make this happen for all workers. Being a JESPA worker, when I hear about a paraprofessional who pays the district after getting a paycheck because they don't make enough to cover their family, that just saddens me. I'm not saying you all don't feel the pain of high costs, but you don't feel it like that. So what can we do together to fix this problem? Because it's only going to get worse if we don't start now. Like what Brooke was saying, we need to get a percentage in. We're willing to do what it takes to get there. I know $33 million sounds like a lot of money. It is a lot of money. It doesn't sound like a lot of money. But we're willing to do what it takes to get that. We have a lot of people. We can make a lot of phone calls. We can do a lot of door knocking to get a mill passed in Jeffco. We just need a seat at that table to make sure that we're not left behind when it happens.
Thank you.
Yeah, so, think that we just have to want it bad enough too, We have to work together to, I don't know, I just feel like we've been working so hard to even be in the top 3 for so long and pay for our employees, are licensed anyway, and I'd like to see us be number 1 in all of our employees, our ESPs, our license, our admin, everybody. I mean, we work very hard to make kids' lives better and our communities better. And I'd like to see Colorado start funding public education as well. And that may sound aspirational, but I don't think that people will start trusting us until we tell them exactly what they're paying for. And I think, benefits and salaries to our educators that are on the ground is something that our community would support.
So I think with that, we'll be ready on the 20th for, did you say there's going to be a counter?
Yeah, we
on
will.
the 20th?
Yeah. Sorry. Yes, we will certainly do our best to bring back a counter. As we've discussed in BAC and JESPA and JCEA negotiations, we might not be able to bring a counter that has cost until compensation, but we will bring a counter to the potential of a restructure as we are able.
Sounds
Again,
good.
any language, we're welcome to, we're happy to go back and forth on redlining language as well, if necessary.
Sounds good.
And that is scheduled for Thursday, February 20th. We did modify the time today at the agreement of both teams and the district team, beginning at 12:30, so that our educators don't have to take a full day of sub-planning, unless they choose to, of course. And we have that scheduled from 12:30 to 8 p.m. on Thursday, the 20th.
Okay, thank you. Thank you, everybody, for being here in the audience. Appreciate you spending your time with us this evening, and we'll see everyone on the 20th.
Thank you.